What's up, guys? How y'all doing today? Hope y'all are doing awesome. Welcome back to the podcast. Today we're going to be doing something a little different that I don't normally talk too much about, but kind of a little twist. I normally talk more about Second Amendment stuff, prepping stuff, but today we're going to talk about a little bit about depression and just pretty much everything you need to know about depression. We're going to cover symptoms, causes, treatments, natural remedies, and lifestyle tips and test types, and then we're going to talk a little bit about the mixtures of like depression and anxiety, the depression and OCD, depression and psychosis and pregnancy, and depression with alcohol, and just stuff like that. So we're gonna do that. So it's gonna be awesome. Stay tuned. First thing, it's basically, we all know somebody that suffers from depression if we don't ourselves. So it's like we either suffer from it or we know somebody that does. I suffer from it. Actually, I haven't been technically clinically diagnosed of it, and there's certain reasons why I don't want to be tested for it. I already know I have it, and main reason, I'm not really a big fan of medications. I don't believe in medications because that's kind of, it's just a mask. It's like in my opinion, it's like putting a Band-Aid on a bullet wound. You're just putting a little cover over it. Yeah, you may stop the bleeding, but the bullet's still in there, and it's kind of like that in my opinion. So that's why I don't really, because all they do is they're gonna want to do, if I go to the doctor to get diagnosed of it, they might want to give me medications that I don't really want to take. And another reason is red flag laws. I'm a gun owner, and doctor could say, hey, you have depression. We need to take your guns away. I don't think so. But anyway, those are certain reasons. There's other reasons too, but certain, depression can be temporary or long term. You may find help with medication or different types of therapies, such as cognitive behavior therapy. It's important to seek professional help if you're feeling major depression. Depression is classified as a mood disorder. It may be described as feelings of sadness, loss, or anger that interfere with a person's everyday activities. It's also fairly common. Data from the Center for Disease Control and Prevention estimates that 18% of American adults had symptoms of depression in any given 2-week period in 2019. It's kind of a little older, but it's probably still fairly relevant. But 18.5% of American adults, that's a pretty good number. That's what I'm saying. We all probably know someone. If we don't suffer from it ourselves, we probably know someone that does. So, and that's why I wanted to kind of go over depression. So though depression and grief share some features, depression is different from grief felt after losing a loved one or sadness felt after a traumatic life event. Depression usually involves self-loathing or a loss of self-esteem, while grieving typically does not. So it's kind of a little different. Some people may, after they lose a loved one, they may feel sad, they may feel lonely, but it's a little different than depression. It's kind of depression, it can just happen anytime. I like I said, I suffer from it, and I can just be going about my day, good day, whatever, nothing's wrong, and all of a sudden, boom, it kicks in, and I just start like feeling down, and not, it kicks in for whatever reason, and I know the difference. Some might think it is because, I lost my wife to cancer 6 years ago, kind of sudden. It happened in 2018, around Christmas time ish. Between Christmas and New Year's, we found out it was cancer, and 2 months later in February, it beat her. So she didn't really have much time, and it kind of hit us quick. It was really and I'll go over that maybe in a different episode. I'll go over more of that story, but so I know what grief is like too, and and that might be another topic for another video, is grief, but they are different. It's been 6 years, so there is still some grief, but it's getting a little less. But right now it's just depression. Like I said, it can it can hit me anytime. It's just all of a sudden, just something bugs me at work, and all of a sudden I'm just down, or it happens. In grief, positive emotions and happy memories of the deceased typically accompany feelings of emotional pain. And that's what it is there. It's mostly like you remember back when they were around, and then it just kind of makes you sad, makes you lonely, makes you. And again, that's different from depression. In major depressive disorder, the feelings of sadness are constant. Like it doesn't matter. They don't really go away for days and sometimes even weeks, and they just, like I said, it could happen for no reason whatsoever, and kind of sucks. People experience depression in different ways. It may interfere with your daily work, resulting in lost time and low productivity. It can also influence your relationships and some chronic health concerns. I notice that too. Sometimes when I'm having my moments, I'm not productive. I'm not as productive at work. I can tell. I can tell, man. I just had one of those days. I didn't get enough done. I make commissions, so it hurts me financially sometimes. But when I'm going through an episode, don't seem to get as much done throughout the day, and it sucks. And relationships, sometimes when I'm going through it, sometimes I just shut down. I come home and I just do my thing. I don't really talk to anybody. I go to bed way early, and sometimes my wife doesn't talk to me. So it's like, well, or I don't talk to her. I just kind of like, so I don't talk about it very much. And it can affect, our relationship and health concerns, chronic health. My body I'm always sore. I'm always beat. I'm always tired. I'm always just, I see people my age, not that I'm old, but not that I'm young either. But I see people my age, they're running circles around me. It's like, how do you have all this energy? And it could be related to my conditions that can get worse due to depression include arthritis, asthma, cardiovascular disease, cancer, diabetes, and obesity. All those can be not necessarily caused from depression, but can worsen because of depression. And I think that may have been back to kind of my wife's story, where my late wife, I am remarried. It's been 6 years. I have gotten remarried. Again, I can go over that story on another episode, but I think that's what once she found out her cancer was terminal, she just went downhill. You could tell she wasn't feeling it. She was depressed. You could tell. I mean, obviously she's dying. I don't know I have no idea what she would have been going, what thoughts could have been going through her head, but she seemed to be okay until she found out it was terminal. And then from there, she just nosedived, and maybe she got depressed. Maybe depression was a big part of it. It's important to realize that feeling down at times is a normal part of life. Sad and upsetting events happen to everyone. But if you're feeling down or hopeless on a regular basis, you could be dealing with depression. Depression is considered a serious medical condition that can get worse without proper treatment. Now, what are some of the symptoms of depression? Depression can be more than a constant state of sadness or feeling blue, feeling down, feeling sad. Major depression can cause a variety of symptoms. Some affect your mood and others affect your body. Symptoms can also be ongoing or come and go. General signs and symptoms. Not everyone with depression will experience the same symptoms. Symptoms can vary in severity, how often they happen, and how long they last. If you experience some of the following signs and symptoms of depression nearly every day for at least 2 weeks, you may be living with depression. Feeling sad, anxious, or empty. Feeling hopeless, worthless, or pessimistic. Crying a lot. Feeling bothered, annoyed, or angry. Loss of interest in hobbies and interests you once enjoyed. Decreased energy and fatigue. Difficulty concentrating, remembering, or making decisions. Moving or talking more slowly. Difficulty sleeping, early morning awakening or oversleeping. Appetite or weight changes. Chronic physical pain with no clear cause that does not get any better with treatment, such as headaches, aches, pains, digestive problems, or cramps. And then thoughts of death, suicide, self-harm, or suicide attempts can also. I mean, there's a few of those I seem to get a lot. The crying, not so much, but I get annoyed a lot, angry a lot. I don't enjoy a lot of the hobbies I used to enjoy. Decrease energy. There's a few of these that I even sometimes, probably more often than I like to admit, have, thoughts of, not really thoughts, but kind of suicidal, some thoughts, not like Not like I'm going to commit suicide, but I go through stuff like that all the time too. So it's not another reason I think I probably have it. The symptoms of depression can be experienced differently among males, females, teens, and children. Males experience symptoms related to their mood, such as anger, aggressiveness, irritability, anxiousness, or restlessness. Emotional well being, such as feeling empty, sad, hopeless. Behavior, such as loss of interest, no longer finding pleasure in favorite activities, feeling tired easily, thoughts of suicide, drinking excessively, using drugs, or engaging in high risk activities. I don't drink, don't do drugs, and I don't really engage in high risk activities, but a lot of that other stuff. Sexual interests, such as reduced sexual desire or lack of sexual performance. Cognitive ability, such as inability to concentrate, difficulty completing tasks, or delayed responses during conversations. Sleep patterns, such as insomnia, restless sleep, excessive sleepiness, or not sleeping through the night. Physical well being, such as fatigue, pain, headaches, or digestive problems. Females may experience symptoms related to their mood, such as irritability, emotional well being, such as feeling sad, empty, anxious, or hopeless, behavior, such as loss of interest in activities, withdrawing from social engagements, or thoughts of suicide, cognitive ability, such as thinking or talking more slowly, sleeping patterns, such as difficulty sleeping through the night, waking up early, or sleeping too much, physical well being, such as decreased energy, greater fatigue, changes in appetite, weight changes, aches, pains, headaches, or increased cramps. Children may experience symptoms related to their mood, such as irritability, anger, rapid shifts in mood, or crying, emotional well being, such as feeling of incompetence, I can't do anything right, or despair, crying, or intense sadness. Behavior such as getting into trouble at school or refusing to go to school, avoiding friends or siblings, thoughts of death or suicide or self harm. Cognitive abilities such as difficulty concentrating, declining in school performance, or changes in grades. Sleep patterns such as difficulty sleeping or sleeping too much. Physical well being such as loss of energy, digestive problems, changes in appetite, or weight loss or gain. So yeah, if you know anybody or if you're feeling any symptoms of that, by all means get not necessarily get help, but find someone to talk to. Like I said, I don't talk to people and maybe I should more, and maybe this will help. Maybe we can engage in some conversation. In fact, speaking of which, I've started a Patreon. I'm trying to do it at the lowest cost possible, the lowest price, so that, I'm not charging too much for it. But once I start getting some patrons, I'm going to start doing more Patreon exclusive videos and content. But I'm also wanting to do like more of a conversational thing where we can actually have conversations with each other. We can share our stories, we can share our symptoms, and we can talk to each other and support each other, kind of like a support group, so where we can talk to each other. Sometimes it's hard to open up to people that because you're afraid they might judge you or something. So it's kind of, so I'm trying to start that. I'm trying to keep the price as low as I can. I think I put the price per month at the lowest price point possible because I don't feel like you should pay for it at all, let alone to, so I figured I'll put it at the lowest possible price. So if you feel like joining Patreon, like I said, I have none yet at the time of this recording. I just barely started it. So if you're feeling like you need someone to talk to, you want to support the channel, you want to support, the podcast, you want others to talk to, sign up. I'm here. I'll always be there. I'll always talk to you because, like I said, I'm going through the same thing. If you feel like you need that support, feel free to join. I'll leave, link down below for it. Just click on that. I'll also leave Facebook links and all that kind of stuff. So anyway, depression causes. There are several possible causes of depression that can range from biological to circumstantial. Common causes include brain chemistry. There may be chemical imbalance in parts of the brain that manage mood, thoughts, sleep, appetite, and behavior in people who have depression. Hormone levels, changes in female hormones, estrogen or progesterone during different periods of time, like during menstrual cycle, postpartum period, premenopause, or menopause, may all rise a person's risk for depression. Family history, You're at higher risk for developing depression if you have a family history of depression or other mood disorders. Early childhood trauma. Some events affect the way your mood reacts to fear and stressful situations. Brain structure. There's a greater risk for depression if the frontal lobe of your brain is less active. However, scientists don't know if this happens before or after the onset of a depressive symptom. Medical conditions. Certain conditions may put you at higher risk, such as chronic illness, insomnia, chronic pain, Parkinson's disease, stroke, heart attack, and or cancer. Substance abuse. A history of substance or alcohol misuse can affect your risk. Pain. People who feel emotional or chronic physical pain for long periods of time are significantly more likely to develop depression. Risk factors. Risk factors for depression can be biochemical, medical, social, genetic, or circumstantial. Common risk factors include sex. Prevalence of major depression is twice as high in females as it is males. Females, you're twice as likely to be depressed as males are. Genetics. You can have increased risk of depression if you have family history of it. Socioeconomical status. Socioeconomics status includes financial problems, and perceived low social status can increase your risk. So if you're, low income, you're struggling, you'll have a lot of stress from unemployment or just the economy. The economy is horrible right now. Stuff like that could cause it. Certain medications. Certain drugs including some types of hormonal birth control, not good with a lot of these kind of medical terms. So steroids, basically a steroid, and beta blockers may be associated with an increased risk of depression. Vitamin D deficiency. Studies have linked depressive symptoms to low levels of vitamin D. Gender identity. The risk of depression for transgender people is nearly fourfold that of cisgender people, according to a 2018 study. Fourfold, 4 times for transgender. Go figure. Not going to get into that. That's a little too political for this conversation, but maybe at some point. Substance misuse. About 21% of people who have a substance use disorder may experience depression. 21%. Mental illness. Depression is associated with other chronic medical illnesses. People with heart disease are about twice as likely to have depression as people who don't, while up to 1 in 4 people with cancer may also experience depression. If you have cancer, you're likely to have depression as well. Okay, moving along to treatments for depression. You may successfully manage the symptoms with one form of treatment, or you may find a combination of treatments that works best. It's common to combine medical treatment and lifestyle therapies, including the following. Medications. Your healthcare professional may prescribe selective serotonin reuptake inhibitors. Again, not good with these medical terms, so you'll have to bear with me as I go through these. SSRIs, selective serotonin, the thing I just said, are most commonly prescribed antidepressant medications and tend to have a few side effects. They treat depression by increasing the availability of the neurotransmitter serotonin in your brain. SSRIs should not be taken with certain drugs, including monoamine oxidase inhibitors, and in some cases, pymoids, thioiodazine, or ORAP. Don't know those terms. Look them up. I'll look them up. I'll figure it out, but should be taken with those types of drugs. People who are pregnant should talk to their healthcare professional about the risk of taking SSRIs during pregnancy. You should also use caution if you have narrow angle glaucoma. Examples of SSRIs include Celexa, Lexapro, Luvox, Paxil XR, Paxiva, and Zoloft. Zoloft is probably one of the more popular ones. Serotonin and Ributake inhibitors, SNRAs. I should have studied up on this part of it a little bit more, these medical terms. SNRAs treat depression by increasing the amount of neurotransmitters serotonin and norepinephrine in your brain. SNRAs should not be taken with MAOIs. Should you use caution if you have liver or kidney problems or narrow angle glaucoma. Examples of SNRAs include Prestique, Kaledevlazela. All right, I'm not even going to try. Some of these other ones are, this is all going to be the same. But there's medications you can take. I'm not going to try and go through all these and struggle through it. You go on this. There's a lot of these examples, and you can look them up. I can leave, I can take a screenshot of this or something, or I can type this up in the description or something if you really want to know it, or it's on, basically, a lot of this came off of healthline.com. So, if you want to look it up, you can, but some of these are kind of tough. I'll skip through a lot of the medical terms because all I'm doing is struggling through it. Let's go to psychotherapy. Speaking with a therapist can help you learn skills to cope with negative feelings. You may also benefit from family or group therapy sessions. Psychotherapy, also known as talk therapy, is when a person speaks to a trained therapist to identify and learn to cope with the factors that contribute to their mental health conditions such as depression. Psychotherapy has been shown to be an effective treatment in improving symptoms in people with depression and other psychiatric disorders. Psychotherapy is often used alongside with pharmaceutical treatment. There are many different types of psychotherapy, and some people respond better to one type than the other. And that's, again, another reason I'm starting this Patreon, so that you don't have to worry about paying a therapist. I'm a lot cheaper than a therapist, and I'm not a therapist. You're not going to get professional advice, but we can share our stories. We can talk to each other, and you're looking at $3 to $5 a month, where if you go to a therapist for this, a professional, they're going to charge you hundreds, if not thousands of dollars. So if we all just join together, we can talk to each other. We can help each other out. We can be, a family, a group. We can, you're not just patrons. You're not just subscribers. We're family. Let's join up. Like I said, it's only whatever the cheapest is. I'm going to go in there and look and see if it's the cheapest. If not, I'm going to drop it down and we're going to go from there. So check it out. Check my Patreon out. Let's get together. Let's have some conversations. Let's help each other out. Cognitive behavioral therapy. Cognitive behavioral therapy, again, kind of the same thing. A therapist will work with you to uncover unhealthy patterns of thoughts and identify how they may be causing harmful behavior reactions and beliefs about yourself. Your therapist might assign you homework where you practice replacing negative thoughts with more positive thoughts. Join Patreon. Dialectic behavior therapy. Dialectic behavior therapy is similar to CBT, cognitive behavior therapy, but puts a specific emphasis on validation or accepting uncomfortable thoughts, feelings, and behaviors instead of fighting them. The theory is that by coming to terms with your harmful thoughts or emotions, you can accept that change is possible and make a recovery plan. Psychodynamic therapy. Psychodynamic therapy is a form of talk therapy designed to help you better understand and cope with your day-to-day life. Psychodynamic therapy is based on the idea that your present-day reality is shaped by your unconscious childhood experiences. In this form of therapy, your therapist will help you reflect and examine your childhood and experiences to help you understand and cope with your life. Light therapy. Exposure to doses of white light can help you regulate your mood and improve symptoms of depression. Light therapy is commonly used in seasonal affective disorder, which is now called major depressive disorder with seasonal pattern. Talk to a healthcare professional before using light therapy. Those with bipolar disorder can be at risk for mania using light therapy. And there's also electroconclusive therapy. Electroconclusive therapy uses electrical current to induce a seizure that has been shown to help people with clinical depression. It's used in people with severe depression or depression that is resistant to other treatments or antidepressant medications. During ECT procedure, you'll receive an anesthetic agent which will put you to sleep for approximately 5 to 10 minutes. Your healthcare professional will place cardiac monitoring pads on your chest and 4 electrodes on specific areas of your head. They will then deliver short electrical pulses for a few seconds. You will neither convulse nor feel the electrical current and will awake in about 5 to 10 minutes after treatment. Side effects include headache, nausea, muscle ache, soreness, and confusion or disorientation. Patients may also develop memory problems, but these usually reside in the weeks, months after treatment. Those are some odd side effects. I would think not on that one, because I mean, like seriously, a lot of these are you go to a therapist, you go to a doctor, and they're just gonna charge you up the wazoo. Where I think if we just have like a support group where we talk to each other, we can kick some of this stuff in the butt and do it for next to nothing. Like the channel, Poor Man. We're poor. We can't. Some of us can't afford to go out there and do that. Alternative therapies. Ask your doctor about alternative therapies for depression. Many people choose to use alternative therapies alongside traditional psychotherapies and medications. Some examples include meditation. Stress, anxiety, and anger are triggers of depression, but meditation can help change the way your brain responds to these emotions. Studies show that meditation practices can help improve symptoms of depression and lower your chances of a depression relapse. Acupuncture. Acupuncture is a form of traditional Chinese medicine that may help ease some of the symptoms of depression. During acupuncture, a practitioner uses needles to stimulate certain areas of the body in order to treat a range of conditions. Research suggests that acupuncture may help clinical treatments work better and may be as effective as counseling. Again, I don't know about sticking needles in me either. That's not exactly my idea of ideal. Anyway, as I said before, we're Poor Man's Preparedness is my YouTube channel. And we talk a lot about preparedness stuff and gear and stuff like that. But since we're kind of poor man, we try to do things on a budget. So I wanted to show you this little. It's a budget blade that I use. I keep this in my bag, my pack. It's the SOG Tellus. It's a really good blade. I haven't used this one much. Like I said, I keep it in my bag. So it's like, but it's extremely sharp. Comes sharp. It comes with a nice Kydex sheath. I'm not sponsored by these guys by any means. I'm not at all sponsored by them. I don't sell them. I don't have a store. I don't have really any sponsors. I do all this myself, but I am an Amazon affiliate, and I can leave a link for one of these down below. If you want to get one, they're like $40, $50 maybe. I mean, it's not cheap exactly, but it's not super duper expensive. If you hit that link and buy one, you're getting a good solid knife at a good price, and you're also helping me out with a few pennies. So I just wanted to show you that. Like I said, we are Poor Man's Preparedness. So, and it's not necessarily that we're poor. We're broke all the time, but we're not just trying to do things on a budget, on a very, very tight budget. Because even the poor people need to prep and be ready for hard times, because they're coming, and it is what it is. But anyway, let's finish this up real quick. I wouldn't say real quick. Still got 2 more to go, but natural remedies and lifestyle tips. Exercise. Aim for 30 minutes of physical activity 3 to 5 times a week. Exercise can increase your body's production of endorphins, which are hormones that improve your mood. Avoid alcohol and substance abuse. Drinking alcohol or misusing substances may make you feel better for a little bit, but in the long run, these substances can make depression and anxiety symptoms worse. Learn how to set limits. Feeling overwhelmed can worsen anxiety and depression symptoms. Setting boundaries in your professional and personal life can help you feel better. Take care of yourself. You can also improve symptoms of depression by taking care of yourself. This includes getting plenty of sleep, eating a healthy diet, avoiding negative people. Avoid negative people. I like that one. And participating in enjoyable activities. Sometimes depression doesn't respond to medications. Your healthcare professional may recommend other treatment options if your symptoms don't improve. These options include electroconclusive therapies or repetitive transcranial magnetic stimulation to treat depression and improve your mood. Supplements. Several types of supplements may have some positive effects on depression symptoms. Take care to discuss any new supplements you may be taking with your healthcare team, as some supplements can have significant side effects or interact with medications. Okay, there's some more of those medical terms of some of those supplements that you can take that have medical terms that I don't feel like reading because they're too hard, but there's other supplements you can take. I can leave those down below if you really want, but vitamins. Vitamins are important to many body functions. Research suggests 2 vitamins are essentially useful for easing symptoms of depression. Vitamin B, B12, and B6 are vital to brain health. When your vitamin B levels are low, your risk for developing depression may be higher. Vitamin D, sometimes called sunshine vitamin. Vitamin D is important for brain, heart, and bone health. There may be a link between the vitamin D deficiency and depression, but more research is needed. Many herbs, supplements, and vitamins claim to help ease symptoms of depression, but most haven't shown themselves to be effective in clinical research. Depression test. It's like basically testing yourself for depression. There isn't a single test to diagnose depression, but your healthcare provider can make a diagnosis based on your symptoms and psychological evaluation. In most cases, they'll ask a series of questions about your moods, appetite, sleep pattern, activity level, and thoughts. Because depression can be linked to other health problems, your healthcare professional may also conduct a physical examination and order blood work. Sometimes thyroid problems or a vitamin D deficiency can trigger symptoms of depression. It's important not to ignore symptoms of depression. If your mood doesn't improve or gets worse, seek medical help. Depression is a serious mental health illness with the potential for complications. If left untreated, complications can include weight gain or loss, physical pain, substance use disorder, panic attacks, relationship problems, social isolation, thoughts of suicide, self-harm. So if you don't treat it, they could do that. Types of depression. We'll try and move quick. I'll try and hurry through these two if we're kind of getting long. Types of depression. Depression can be broken into categories depending on the severity of symptoms. Some people experience mild and temporary episodes, while others experience severe and ongoing depressive episodes. There are 2 main types of major depressive disorder and persistent depressant. There are 2 main types: major depressive disorder and persistent depressive disorder. Major depressive disorder, MDD, is the more severe form of depression. It's characterized by persistent feelings of sadness, hopelessness, worthlessness that don't go away on their own. In order to diagnose with clinical depression, you must experience 5 or more of the following symptoms over a 2-week period: feeling depressed most of the day, loss of interest in most regular activities, significant weight loss or gain, sleeping a lot or not being able to sleep, slowing thinking or moving, fatigue or low energy most days, feeling of worthlessness or guilt, loss of concentration or indecisiveness, recurring thoughts of death or suicide. There are different subtypes of major depressive disorder, which the American Psychiatric Association refers to as specifiers. These include Atypical features, anxious disease, anxious distress, mixed features, pre or peripartum onset during pregnancy or right after giving birth, seasonal patterns, melancholic features, psychotic features, or catatonia. Persistent depressive disorder. Persistent depressive disorder, PDD, used to be called dysthymia. Dysthymia. It's a milder but chronic form of depression. In order to diagnose to be made, in order for for the diagnosis to be made, symptoms symptoms must last for at least 2 years. PDD can affect your life more than major depression because it lasts for longer periods of time. It's common for people with PDD to lose interest in normal daily activities, feel hopeless, lack productivity, have low self-esteem. Depression can be treated successfully, but it's important to stick to your treatment plan. Living with depression can be difficult, but treatment can help improve your quality of life. Talk to your healthcare professional about possible options. Okay, should we go through the rest of it? 45 minutes? Should be all right. Postpartum depression refers to depression that happens after childbirth. It's a common disorder after pregnancy, affecting 1 in 9 new parents. It's common for people to experience baby blues or feeling of sadness, emptiness after childbirth. For many people, these symptoms go away in a couple of days. But if you feel sad, hopeless, empty for longer than 2 weeks post-childbirth, you may have postpartum depression. Symptoms of postpartum depression can range from mild to severe and can include feeling restless or moody, feeling sad, hopeless or overwhelmed, having thoughts of hurting the baby or yourself, having an interest in the baby, not having interest in the baby, feeling disconnected or as if your baby is someone else's, having no energy or motivation, eating too little or too much, sleeping too little or too much, having trouble focusing, having memory problems, feeling worthless, guilty, or like a bad parent, withdraw from activities you once enjoyed, withdrawing from friends and family, having headaches, aches, or stomach issues that don't go away, feeling empty, unconnected, or as though you might not love or care for the baby. Postpartum depression is thought to be triggered by dramatic hormonal changes that may take place after pregnancy. Bipolar depression occurs in certain types of bipolar disorder when a person experiences a depressive episode. Bipolar disorder is a mental disorder that causes a distinct change in mood, energy, concentration, and the ability to carry out day-to-day tasks. There are 3 types of bipolar disorder, all of which include periods known as manic episodes, where you feel extremely elated or energized, and depressive episodes where you feel down, sad, or hopeless. You may have bipolar disorder. If you have bipolar disorder, it can be hard to recognize the harmful effects of each mood episode. People having depressive episodes may feel very sad, hopeless, or empty, feel slowed down or restless, have trouble falling asleep, waking up too early or sleeping too much, have an increased appetite and weight gain, talk very slowly, forget things, or feel like they have nothing to say, have trouble concentrating or making decisions, feeling unable to do basic tasks, have little interest in activities, have a decreased or absent sex drive, have thoughts of death or suicide. Symptoms during depressive episodes last every day for most of the day and can last for several days or weeks. Bipolar disorder is treated. Many will experience fewer or less severe symptoms of depression if they experience depressive episodes. Depression and anxiety. These are probably, from what I've understand, these are the 2 most common to have together. Depression and anxiety can occur in a person at the same time. In fact, research has shown that over 70% of people with depressive disorders also have symptoms of anxiety. Though their thoughts Though they're thought to be caused by different things, depression and anxiety can produce several similar symptoms, which can include irritability, difficulty with memory or concentration, sleeping problems. The two conditions also share some common treatments. Both anxiety and depression can be treated with therapy, like cognitive behavioral therapy, medication, alternative therapies, including hypnotherapy, hypnosis. If you think you're experiencing symptoms of either of these conditions or both of them, make an appointment to talk to your healthcare professional. You can work with them to identify coexisting symptoms of anxiety and depression and how they can be treated. Depression and obsessive compulsive disorder. Obsessive compulsive disorder causes unwanted and repeated thoughts, urges, and fears. These fears cause you to act out repeated behavior or rituals, compulsions that you hope will ease the stress caused by obsessions. People diagnosed with OCD frequently find themselves in a loop of obsessions and compulsions. If you have these behaviors, you may feel isolated because of them. This can lead to withdrawal from friends and social situations, which can increase your risk for depression. It's not uncommon for someone with OCD to also have depression. Having one anxiety disorder can increase your odds of having another. Up to 80% of people with OCD also have depression episodes. This dual diagnosis is a concern with children too. Their compulsive behavior, which may be first developing at young age, can make them feel unusual, that can lead to withdrawing from friends and can increase their chances of child development depression. Depression with psychosis. Some individuals who have been diagnosed with major depression may have symptoms of other mental disorders called psychosis. When the two conditions occur together, it's known as major depressive disorder, severe with psychosis, psychotic features, or depressive psychosis. Depressive psychosis causes people to see, hear, believe, or smell things that aren't real. People with the condition may also experience feelings of sadness, hopelessness, irritability. The combination of the two conditions is particularly dangerous. That's because someone with depressive psychosis may experience delusions that cause them to have thoughts of suicide or to take unusual risks. It's unclear what causes these two conditions or why they occur together, but treatment can successfully ease symptoms. Treatments include medications and electroconvulsive therapy. Understanding the risk factors and possible causes can help you be aware of early symptoms. Depression in pregnancy. Getting close. I know I've had you almost an hour, but we're getting close. Pregnancy is often an exciting time for people. However, it can still be common for a pregnant woman to experience depression. Symptoms of depression during pregnancy include changes in appetite or eating habits. Pregnancy itself can do that. Feeling hopeless, anxiety, losing interest in activity and things you previously enjoyed, persistent sadness, trouble concentrating or remembering, sleep problems including insomnia or sleeping too much, thoughts of death or suicide. Treatments for depression during pregnancy may focus entirely on talk therapy and other natural treatments. While some women do take antidepressants during their pregnancy, it's not clear which ones are the safest. Your healthcare provider may encourage you to try an alternative option until after the birth of your baby. The risk for depression can continue after the baby arrives. Postpartum depression, which is also called major depressive disorder with peripartum onset, is a serious concern for new mothers. Depression and alcohol. Research has established a link between alcohol use and depression. People who have depression are more likely to misuse alcohol. Out of the 20.2 million U.S. adults who experience a substance use disorder, about 50% had a co-occurring mental illness. Drinking alcohol frequently can make symptoms of depression worse. People who have depression are more likely to misuse alcohol or become dependent on it. Preventing depression. Preventing depression. Depression isn't generally considered to be preventable. It's hard to recognize what causes it, which means preventing it is more difficult. But once you've experienced a depressive episode, you may be better prepared to prevent a future episode by learning which lifestyle changes and treatments are helpful. Techniques may include regular exercise, get plenty of sleep, maintaining treatments, reducing stress, building strong relationships with others. Other techniques and ideas may also help you prevent depression. Outlook for depression. Depression can be temporary or it can be a long-term challenge. Treatment does not always make your depression go away completely. However, treatments often make symptoms more manageable. Managing symptoms of depression involve finding the right combination of medications and therapies. If one treatment doesn't work, talk to your healthcare professional. They can help you create a different treatment plan that may work better in helping you manage your condition. All right, that's that. So like I said, I'm sure everybody at least knows somebody that has symptoms like that. You may have them. You may have it. You may have depression and not even know it. But anyway, again, join Patreon. We can all talk together, work together. Then we don't have to go through all this therapy, because I know sometimes it's just a matter of talk to people, talk to somebody about it. You don't necessarily need to go through all that medication. And says me, I hate medications. I'd rather do it just up here than in here. But that's just me. If you need it, by all means, go get professional help, because especially if you're one of the people that, or know one of the people that have the suicidal thoughts, because we don't need suicide. We don't need that. We don't need a loved one or somebody we know that is depressed and we just didn't want to talk to them, so they did something that they shouldn't have. But anyway, that's the episode for today. Appreciate every one of you. Love y'all. If you're on YouTube, do the YouTube stuff. Like, subscribe, share, comment. You know all the stuff. Do the YouTube stuff. Check out the links below. Link for the SOG knife, and links for Facebook, links for Patreon. All those links are down below if you're interested. At the time of this recording, I'm unmonetized, but by the time you watch it, I may be monetized again. If I am, hit the super thanks. Do whatever if you feel like it. Hey, if not, just hit the subscribe button. Do me a favor. Do us a favor. If you feel like joining Patreon, let's start building a community, a family. So we can help each other out. Anyway, appreciate y'all. Love you. See you in the next one.